Now, just imagine being in need of blood and you are told that it has to be brought in either from another state or flown in from another country. But that's how rhesus gnaw, popularly called golden blood, is rare in every sense of the word. In this special report, senior correspondent Ivy Kano takes a look at what makes this type of blood group special.
Every second around the world, someone somewhere either needs blood or someone is being transfused. And nature has made it possible that the only thing that all humans have in common, irrespective of race, is blood. This means humans are dependent on one another. There are situations where one would need blood for surgery, or one's body, we were told, could also stop producing enough healthy blood for transfusion to be carried out without complications. Cross-match is performed before administration between the receiver and potential donor's blood. Though there are 45 blood group systems, 4 are most common blood groups, but our focus is on rhesus gnaw, also known as the golden blood. In the course of doing this report, I'm going to ask Nigerians if they know their blood group and also if they've ever heard about the golden blood.
I am AA and O positive.
AA, yes, is my blood group.
Mine is O positive.
A positive. And I've not done a test for my blood group.
Golden blood? No.
At all? No.
Since it's said that about 50 people are said to have the golden blood in the whole world, who knows, you could have 1 or 2 of those in Nigeria. We'll be heading straight to the Lagos State Blood Transfusion Center at Bagada to find out more information about the golden blood. On getting to Bagada General Hospital, we met the Executive Secretary, Lagos State Blood Transfusion Committee. She breaks down all we needed to know, starting with why it's called the golden blood.
A person with rhesus gnaw does not have any of the 49 antigens. They need to be strictly managed. Some of the treatment is for them to do an operation to remove that part of our body that helps us to destroy cells. So the spleen, which is at the left side of the body, sometimes I just have to remove them.
Obvious, there is a reason why golden blood is special.
There's a study that says they are like 1 in 6 million, another said 1 in 10 million. I even saw one in 60 million. But the most important thing is that as at now, we have less than 50 of them in the whole world, of which only 9 of them can donate blood. Because you can't find them anywhere, anyhow. They put them in the rare blood donors register so that when anybody needs such blood, they are called upon to give them blood. Those people with golden blood are unable to have that flexible cells. So the shape of the cells are different and they are also very, very firm. The cells break easily and they have a condition called hereditary stomatocytosis. So such people can present with yellow eyes sometimes. They can present with anemia. Their blood is never adequate. And such people might need to depend on blood. However, these same people cannot receive blood from anybody except people like themselves. And there are very few. So if somebody needs blood, if there is a rhesus gnaw in Nigeria, for example, you might have to call Australia for somebody that has that to give us blood. So you see why they're actually called people with the golden blood.
Who are those most likely to be born with this rare type of blood?
Some people, for one reason or the other, their genetic components just malfunctions. You notice that all these less than 50 people, they were offshoots from consanguineous marriages. So people that maybe married their brothers or their cousins, they notice that all of them were offshoots of consanguineous marriages. It could also be that the 2 parents could have given that child that recessive gene.
She admits that more research has to be done on the golden blood in the country, especially for the sake of pediatricians. But is it possible we could have 1 or more people with this blood type in Nigeria, and what could be their fate?
So many healthcare professionals are ignorant about it. So could it be for that reason, we have not even checked or investigated for it, especially for our pediatricians. Because once the child comes, the child is and is having that hemolysis, as in the body is destroying the cells on its own from birth. We could just, if our pediatricians have a high index of suspicion for it, then we might just be able to know. And even in this way, even though we do not have so much capacity to check for the genetic, the genetic abnormality, we can still screen them by having something called the screening cells. Because most of them will die at a young age. Because immediately the child is coming in, is not feeling fine. I know because it is coming, it's an inheritance. Spiritually, the mother is always giving birth to a child that is dying. The child is always having yellow eyes. He's always having yellow fever. There must be something spiritual about it. And if it's a female that has ended up growing to a particular level, the female might have difficulties in carrying pregnancies. So if you do a job well, by doing a good cross-match, by doing a good antibody screening, you might be able to at least identify that there's an abnormality somewhere, which we now investigate for later. So really, I'm really happy that we've come to talk about this. It came as a shock. What do you want to do with golden blood?
Our crew was taken through the process of blood collection, which begins with a donor registration, then counseling.
So when the donors come in, use our disposable donor couches just to ensure that there is right infection prevention and control measures in place. Do a lot of processing to ensure that a unit of blood saves more than one life.
From there, the grouping and cross-matching section. In the course of doing this report, we realized that some Nigerians do not know the difference between their genotype and blood group. It is also important one has this information stored in the phone. In emergencies, when blood transfusion is needed and the patient's red blood type is not known, golden blood would come in handy, and that's why it is said to be life-saving. Information has it that anyone found to have the golden blood are treated with care and are advised to live life more carefully. Dr. Shikomaya advised that the federal government opens a national register to help document resource null people if found in the country, knowing how important they are to saving the lives of others. Ivy Kano, TVC News, Lagos.